This issue first came to my attention, as Curt pointed out, more than a decade ago when a newspaper in my state ran a series called Deadly Restraint about the use of seclusion and restraint in children in Hartford, Connecticut, or in Connecticut rather. In that article I read about Andrew McLean. He was an 11-year-old boy who died from cardiac arrest under restraint in the hospital in Connecticut. And as a senator and as a parent, those stories chilled me to the bone. They still do to this day. And after 2 years of working with the network and others, we were able to get a law enacted that prevents abuse in hospitals, group homes, and residential treatment facilities. Though we'd pretty much taken care of the issue by covering the ground. The one institution we left out was schools. We didn't add the word schools in that discussion and debate. And I regret that looking back now that we didn't. But at the time, we faced a lot of opposition because the assumption was this is best taken care of at the local level. And I don't argue with that. I wish that were the case. I'm not overly anxious necessarily to have federal laws running around trying to mandate these situations, except when you're faced with the statistical evidence that too little of this is actually going on and providing any support and protection. And a child, wherever they live in this country, ought to be able to know that their national government, and parents ought to know, is going to step up in these matters when action is not being taken. And as I said, in this case, we did not include children. Last year I worked to include a ban for schools in the Substance Abuse and Mental Health Services Administration bill, but the underlying bill did not become law. And many of those who resisted the federal ban told us that state laws should be adequate to protect our children. This report shows us how wrong that assumption is, and why it's so valuable, and why we'll be going back. It includes examples of children being tied, pinned down, locked in closets, isolated from their fellow students, and battered in some 33 states across the country. In some of these cases, they resulted in the death of a child, as Curt has pointed out. 22 states and territories have no laws, no policies, no guidance whatsoever on the use of seclusion and restraint of children in schools whatsoever. Nothing at all in 22 states. And 25 of our states and territories require automatic notification of parents or guardians when seclusion and restraint are used. But half our states don't at all. So we're pleased that 25 at least do that. But the fact that half our states don't even require the notification of a parent when you send your disabled child to a classroom and they're being restrained and using physical restraints on them, and you're not letting the parents know. Put yourselves in the shoes of a parent of a disabled child. Spend countless hours at home trying to ensure your child, guarantee them that everything she needs will be there, they'll be safe, they'll be secure in that environment. It's never easy, but as any parent will tell you, it's worth every minute of it. And then to find out after the fact, despite all of those reassurances, that in fact that child discovers that parental reassurance is not necessarily there. After all the hard work, I can't imagine how terrible that feeling must be when you learn that your child has been mistreated and physically abused at school, of all places. I'm proud to say that because of the stories that ran in Connecticut newspaper, and the work of parents and grandparents like those standing with us today that I've introduced already, Connecticut is working to become a good example on this issue, and I'm proud of my state for doing so. In recent years, we have put some of the best protection laws on the books in the country, restricting the use of seclusion restraint, banning prone restraint, requiring automatic notification of parents when seclusion and restraint are used, and ensuring that school personnel are trained in avoiding use of seclusion and restraint and preventing injuries. We're not done in Connecticut, but we're not done across the country providing some of those protections. And I plan to use this report, Curt, in this Congress to help our cause. And together we will continue to work towards the ban of use of seclusion and restraint in schools, except in very rare emergency situations where the safety of students, staff, and others is threatened. We will encourage the use of best practices, require school personnel to receive proper training. And this is only one sentence here, but it deserves to be emphasized. There are a lot of good people in our schools. I'm not suggesting otherwise. But if you're not well trained to how to deal with these situations, a good person can take some bad steps. They're not bad people. And part of it has been here getting people to understand this. The great news, obviously, with the Americans with Disability Act was providing that mainstreaming of children. One of my daughters goes to a public school here in town, and there's an autistic child in her classroom. who's turned out to be one of Grace's best friends. The treatment, it's a wonderful thing. My child has every day the ability in a classroom with other children to meet and understand what a child with a disability is going through. It's great for this young child as well. So it's been a wonderful thing for our country to have this. But I want to know that parent knows when that child, that autistic child is going to, that she's going to be safe. And she needs moments when she has to be alone. And every now and then she is disruptive a bit in that classroom. But they're well trained in that classroom and they handle it well. And the concern we have is in too many places, the children in these situations, and we haven't spent the resources to train people to make sure they're there so they understand how to accommodate and deal with these situations as they emerge. So I don't want my comments here to be seen as an indictment of everyone in the school system. That's not the case. It's just trying to get this to work right. So we need to encourage, as I said, best practices and requires school personnel to get good training, mandate prompt reporting, and so forth. We can keep our children safe if schools keep their practices. We can't keep them safe, but they keep their practices secret. It's that simple. And so let me thank the network again for this report. It will be a great asset to us in the coming days and weeks and months as we go forward with this, Curt, to try and have this included in as part of the law. I want to also say as well to my wonderful staff who work so hard on these issues, and I thank them immensely for the work they've done on this, that we did pass laws, and unfortunately the Bush administration has not issued any real regulations on this. Jeremy, how long has it been since we passed it?
8 years.
8 years? And not a single regulation, despite the law being on the books. So my hope is with an Obama administration, Jim Fenton back here, Jerry, this is a great job on all these issues, and I thank them. But we need to get some regulations in place as well. It's one thing to pass laws, but if you don't get the executive branch to sign a law, then do anything about it. Obviously, it's disappointing. So we have our work cut out for us, but we've succeeded in the past. And with the help of people in this room and others, I believe that we can get this job done as well in a balanced, thoughtful, sensible way, but to further advance the cause of our children and to see to it that they're going to be protected in these classroom settings. So I thank you.